My name's Shelby. I'm going to be the nurse taking care of you today. Could you please tell me your name and date of birth? Okay, I'm just going to go ahead and identify with the wristband here, and it matches. So I'm going to be performing a HEENT assessment today. So this includes have you had any recent headaches, dizziness, any vision difficulties, diagnoses, any pain in your eyes, any history of infections, injuries to your eyes? Okay. And then do you wear any contacts or glasses? Okay. Have you noticed any hearing loss? Any alterations with hearing? Okay, so to start with the head, I'm going to note that the shape is round. Your head appears to be symmetric. Your hair texture is soft. Hair is evenly distributed. I'm not noticing any lesions, sores, or masses. Do you have any tenderness when I'm palpating? No? Okay. Next, I'm going to assess for TMJ. So I'm going to go ahead and place my hands on your face, right at the temporal mandibular joint, and I'm going to have you open and close your mouth for me. Okay, perfect. Okay, no TMJ noted upon assessment. Next, we're going to move on to the lymph nodes and salivary glands. So what I want to do for this is I'm going to go ahead and start by palpating the auricular. So this is going to be lymph nodes that are going to be in front of the ear and behind the ear. Next, I'm going to do occipital, which will be back behind the head, or the base of the head, or skull. Submandibular is chin, or mandible, excuse me. And then submental is chin. Then we'll be doing cervical, which will be down the neck. Then we'll have supraclavicular, so supra meaning above the clavicle, supraclavicular. And then infraclavicular, below the clavicle. Any pain or tenderness when I'm palpating? No? Okay, I'm not noticing any swelling or tender lymph nodes upon palpation. Next, we're going to check for perla, which is pupillary reaction to light. So we're going to assess for pupils that are equal, round, reactive to light, and accommodating. So I've got my otoscope here, which pen light, otoscope, whatever you can use. And what I'm going to be doing is I'm going to shine a light in your eyes, okay? So I'm going to cover one eye. I'll have you look right at me. So what I'm going to have you do is just follow my pen light, and you're going to follow it in towards you, okay? Just with your eyes. Beautiful. So pupils are perla. Equal, round, reactive to light, and accommodating. Okay. Next, I'm going to be assessing your extraocular eye movements or muscle integrity of your eyes. So I'm going to start with using, or completing this by using the 6 cardinal positions. So I'm going to start right here in the middle. I'm going to have you follow just my pen with your eyes only. Okay. Patient has appropriate EOM with all 6 cardinal positions, and I am noting that there is no nystagmus upon my assessment as well. Next, I would use a large or a small handheld Snellen chart. So when doing this, we're going to hold the Snellen chart about 20 feet away. I'm going to have you cover one eye. For the next part of the assessment, I'm going to be inspecting the ears. So I'm going to do this, normally on a real patient, you're going to have both sides you're going to be inspecting. But for this video, I'm going to be just inspecting one side. Whatever I do to one side, I do to both. So first with inspection, I'm going to assess the pinna, which is this outer layer of the ear. Okay, I'm going to note that it's symmetric. I'm not noticing any deformities, discharge, or redness just by looking at it. Next, I want to palpate. So will you just let me know if you have any pain or tenderness when I'm palpating? Okay, no pain or tenderness upon palpation. Next, I'll be using my otoscope to inspect the eardrum. I'm going to visualize that. So I'm going to go ahead and put down, make sure it's turned on. Okay. The eardrum is gray, pearly, shiny, and you should be able to slightly see through it. Okay, I'm not noticing any redness or swelling of the eardrum. Next, I'm either going to perform the whisper test or the full calfrast. So for the whisper test, what I would do is I'd have my patient close their eyes. I would then stand a foot or so behind them, and I would have them with their eyes closed. Let me know or repeat back the word that I'm saying to them on either side of their ears. So for this instance, can you repeat back the word? Banana. Okay, the patient said banana. And then you could do it to the other side and test both. Next one that we could do is the calfrast. I'm going to do the modified calfrast. So with this, so normally you could test both sides here or there, but just since I'm on this side of the bed, I'm only testing this one side. Okay, but I'm going to inspect first. So I'm going to want to look up with my otoscope or pen light, look into the nasal passage. Okay, I'm not noting any redness, discharge, swelling, or drainage. It appears that the septum is not deviated, it is midline straight. I'm also noting the turbinates as well. And then what I'm going to have you do is I'm going to have you plug one side of your nose and sniff in. Okay, and then plug the other side. And this is called the congestion test. So this is where you're going to have the patient breathe through one nostril at a time to see if they're congested. So no congestion noticed. Next I'm going to have you hang out there still. I'm going to palpate over the nose for tenderness. So any tenderness or pain? No. And then I'm going to palpate over your sinuses. Any pain or tenderness? No? Okay, good. Next we're going to move to the mouth and throat. So what I'm going to do first is I'm going to inspect your lips and teeth. It appears that your teeth are all intact. I'm not noticing any missing teeth. Your lips are dry, pink. Not noticing any cracks or lesions on your lips. Next, I'm going to have you open your mouth with my pen light or otoscope in this case, which you can use either or. I'm going to inspect the inside, so I will look in your mouth. I want to note that the buccal mucosa is pink, moist, and intact. I'm also going to want to assess your tongue. I'm going to look at both upper part of your tongue and underneath, dorsal. So it appears that your tongue has no lesions or sores. I'm not noticing any redness, masses, swelling of your tongue. I want to also note that the uvula is midline and freely movable. I also want to note that there is no redness or swelling of either tonsils. And I can visually see the hard palate, which is in front, soft palate, which is behind it, and then the tonsillar pillars and pharyngeal wall. No redness, swelling, or drainage from those either. We're going to move to the neck and thyroid. So in this case, you can change or take off your gloves. So first I want to note that the trachea is midline.